Hi ladies. So a question that I get all the time is, should I exercise whenever I'm later on in my pregnancy? So thinking about third trimester, latter third trimester, they're like, I feel like I should maybe be moving. Should I? What's dangerous? What's not? Should I even be doing exercises? Should I just walk? What's the deal? So I hate this answer, but it does depend. It depends on your prior level activity. It depends on if you have any previous conditions like hypertension, preeclampsia, maybe you're pregnant with twins, maybe you have gestational diabetes. That's going to factor into what type of exercise you should do. However, there's a common denominator here. You should stay active and exercise during the later portion of your pregnancy. Why? Because it's going to help those hips move. It's going to help move baby, help move you, not let those tissues get stagnant and just really keep you thriving through your pregnancy. Now, as baby grows, there's going to be a few more aches and pains. There's going to be a little bit more maybe things you run across, whether that might be varicose veins, maybe a hernia, there's multiple things that could factor in, or maybe you're just going through it and you're just getting bigger around the tummy area, having some round ligament pain, having some SI joint pains and things of that nature. You kind of play on, whether you want to exercise, right? You're thinking, should I even be doing something? Well, I'm here to tell you, yes, you should, okay? Because it's actually going to help with those conditions. What we do, how we do it, is what's going to change. So things that are still good are things like squats, mobility work, yoga, maybe walking, doing different things, even lifting with lighter weights is okay. And it's optimal. What's going to work best for you and your body is going to be different and tailored just to you. But again, it is still beneficial for you to stay moving during the later stages of your pregnancy. So for example, maybe you were super active and you love to run, or you really love to lift weights and you've been doing CrossFit, or you're just starting out and you're like, what the frick, I don't even know, what I like to do yet. All of these examples, let's run through those and I'll kind of give you some examples of what we might do. So with the running, maybe that first trimester, not much changes. As baby grows and baby shifts, second trimester, we might start dialing some stuff back, focusing a little bit more on technique, just making sure that our breathing is optimal and pelvic floor is functioning. Then we lead into third trimester. That's whenever I'm really going to start to look at cutting our mileage back. Quality over quantity is going to be huge here. And then again, optimizing our breathing habits, mobility, and getting some other varieties of movement in. Not going to cut you off from running unless we have any red flags, but that's kind of what we would look at. So CrossFit is one of those where we're just going to especially if you're a CrossFitter who's been doing it for a while, we're just going to be looking at quality over quantity, trying to cut back on the amount of weight used. And especially whenever we get into that 36, 37 prepping period for weeks time frame prepping for baby, we're going to really, really cut it back. It might even go down to body weight. You're still going to do the same exercises and still move, but we won't be loading your bar. We might do it with a woman's female bar, or maybe you do body weight, whatever you feel comfortable with where we don't see any red flags, okay? And then say you're just starting out and you were like, okay, so for the first trimester of my pregnancy, I was dying. I had a lot of morning sickness or whatever the case might be. And you're like, okay, but what about me? I am just now starting out. Should I be active later on in my pregnancy? And the answer again is yes. Now, you're not restricted just to walking. You can still introduce some yoga postures, start moving in different ways. It's again just going to look a little bit less intense, going to look a little bit less forced. It's going to be a little bit more dialed in on just kind of moving the body, getting those hips moving, getting the pelvis moving, dialing in our breath, and just still trying to keep the body fluid and moving and get that benefit for both you and baby without compromising anything. Okay? So those are just 3 different situations. Again, exercise is beneficial for mom and fetus. The fetus, it loves that movement. There's studies put out by the British Journal of Sports Medicine that actually say how beneficial exercise is for both parties, pregnant mama and fetus. So don't let your exercise go as you get into that later stage. We just need to optimize it, okay? So we're just gonna switch it up just a little. If you have any questions or if I can help you out, please shoot me a message. Otherwise, I guess I will talk to you soon. Bye for now.